Okay, this is just a quick update to follow up on the stuff we were talking about a couple weeks ago with regards to cardiac ultrasound. Um, we looked at all the views last time, and right now we're just going to focus on the peristernal long apical 4 and apical 5 chamber, followed with a video on how to get these views and to do some calculations. So just recall that in the peristernal long axis, we have the indicator pointing towards the patient's left hip or left elbow, and the probe is right against the sternum. Apical 4 chamber and apical 5 chamber for that matter, we've got the indicator pointing to the patient's right. And this is all with the dot on the left-hand side of the screen, which is in the the standard radiology configuration. So again, peristernal long, indicator to the left hip, and this is what it kind of looks like. And you get the peristernal long, you see left atrium, left ventricle, aortic outflow tract, right ventricle, and this is the interventricular septum. This is the posterior wall. This is that mitral valve here, the anterior leaflet, and the posterior leaflet's down here. And this is just a normal peristernal long axis of the heart, and with a quick overlay there just to kind of review some of the anatomy. Now, the apical 4 chamber is obtained by putting the indicator to the patient's right, and you're really going for the PMI, that little place there on the chest where the apex of the heart comes to the chest wall. And this is made easier when you put the patient to left lateral decubitus, as you're about to see. Now, to look at the mitral valve, this is the best view of the apical 4 chambered view, where we can see BART, B-A-R-T, blue away, red towards. In this case, during systole, there is a blue jet that moves away from where the probe's footprint is and into the left atrium. Now, I've explained this before, but people get lost here a lot, so I think it's worth reviewing that. So each time the left ventricle squeezes, as we put color flow Doppler over the mitral valve, we can see a blue jet squirting back into the left atrium. In fact, this blue jet hits the back wall of the left atrium, and that essentially means that the patient has a mitral valve regurgitation. And we do this in the apical 4, not the peristernal long, because recall that when you work with Doppler, you don't want the Doppler to be at a 90-degree angle with the angle of insonation. And in the peristernal long axis, where you look at the mitral valve, you're at about 90 degrees, whereas in the apical 4 chamber view, you're closer to more parallel. The sound is more parallel with the flow of the blood, and you're closer to an angle of maybe 60 degrees or even less, even 45 degrees. So that's the idea. The more parallel you get, the better Doppler works. And this is just another example here of a blue jet hitting the back wall of that left atrium. Not as pretty. We can see it here as well on this tricuspid side. So you can evaluate both the mitral and the tricuspid valves in that apical 4 chamber. And recall that to get the apical 5th chamber, you just simply tilt the probe a little bit more anteriorly. You can see the apical 5th chamber. And I put air quotes around that because really it's just the aortic valve. And this is where we're going to be putting that the pulse wave Doppler in order to measure cardiac output. And so how do we do this again? We start in the peristernal long axis, where here we can see that valve is closed, the aortic valve is closed. And then we scroll along until that valve goes from closed to open. And then we measure the left ventricular outflow tract diameter. Again, this is at the peristernal long axis of the heart. And then you lock that value in to the computer, and basically it takes that value, the LVOT diameter, squares it, times it by pi, divides it by 4, and that gives you the LVOT area. Now, then you move into the apical 5th chamber, which is where we're going to put the pulsed wave Doppler, just right over that, right over this apical 5th chamber here, over that, right where that aortic valve is. And then you're going to activate the Doppler function. That's going to bring up a waveform. And on some machines, what you need to do is trace this envelope using the cursor. On other machines, it's automatically done for you. It sees the waveform and the software traces it itself. And that gives you the velocity time integral. This envelope is the velocity time integral of the left ventricular outflow tract. And that's the idea here. So that gives you stroke volume, and so it's the LVOT diameter, which you supplied the machine, and then you did the pulse wave Doppler over that aortic valve in the apical 5 chamber, and that envelope gave you this velocity time integral. And then that gives you stroke volume. This equation gives you stroke volume. And of course, we know that when you take stroke volume times it by heart rate, you get the cardiac output. And that's really what we're going for.
Okay, so I'm going to start with the P21 probe. I'll have the indicator actually point to the patient's left hip or left elbow, and I'm going to put it against or next to the sternum for a parasternal view, and I will put it right here. And the objective is to get a long axis view of the heart, so the indicator will be pointed towards the patient's left elbow. So on the screen right here, this is what I see. You can see that with each respiratory cycle, lung goes into the ultrasound image. This is a pretty good view, so what I'm going to do is I'm going to take let out your breath. There we go. Okay, so I'm going to take a view right here. Why don't we have the patient breathe out. Good. Right here. So what I'll do is I'll actually scroll back to when the actual leaflets are open, and I think this is the maximal excursion right here. I'm going to hit calculations right here. I'll hit LVOT. Oops. Go back to cardiac output. Hit LVOT, and it'll give me calipers. I'll put the calipers down right here, about right here, and that gives me a diameter of 2.2 centimeters or 2.19 centimeters. I'm going to save this calculation, and I'll go back to hit the back button right here. I'm going to unfreeze it now, and the next thing we need to do in order to calculate cardiac output is to have the patient roll to the left lateral decubitus. So I'll have the patient roll this way. So why don't you put your arm up above your head, and next thing I need to do is I'll obtain an apical 4-chamber view, and this is done essentially against the apex of the heart. So with my hands, the heart, I'm going to essentially try to scan from the apex all the way to the base. And my indicator is actually going to be pointed towards the patient's right. So I'll start right here, and let's see. So on the right of the screen is the left side of the heart, and on the left side of the screen is the right side of the heart. We have the mitral valve and the tricuspid valves here. I'm going to switch this to color Doppler mode right here, and breathe out, Kevin. And what we'll see is flow through the mitral valve. So what you see also here is the aortic outflow tract, and that's actually a 5-chamber view right here. And the next thing I need to do is go back to calculations.
So I would go mode 2D.
Mode 2D.
Can I get that off there? I can get a nice 5th chamber.
Let's see.
It's not as easy as it looks. Yeah.
I'm gonna take off.
Okay.
No. I know you're outside.
I had to listen to it a little bit to make sure I wasn't like.
So we had the
Kevin,
patient.
where'd your heart go?
We had the patient go left.
It's still on there somewhere.
So we could. So we could cut out that segment where we're trying to find.
There you go.
That's good.
There.
Yeah.
Perfect.
Okay. So now continue.
So let's see.
Okay. See you later.
So that's right. So we're going to go to mode, and we will do the Doppler.
Point out the 5th chamber so everybody can
So
see.
this is the 5th chamber right here. So we have the LA, the LV, and then this is the LVOT, and then this is essentially the aortic valve, and this is the fifth chamber right here. So you can see parts of the aortic valve. And so in order to get a cardiac output, we already had the left ventricular outflow tract diameter. What we're going to do next is we're going to measure the pulse wave Doppler, and based on the spectral analysis, we'll be able to get an approximation of the cardiac output. So I'm going to hit that. Actually, this is, I don't remember this. Right here, just where the valves are. Let's see.
It's good.
Yeah. And we'll hit that again.
Page 2. Trace.
Let's do a retake of that.
Yeah, it's basically the idea.
Okay. So we have a four-chamber apical view of the heart. This is the apex. This is the left side of the heart and the right side. We have the left ventricle, left atrium, right ventricle, right atrium. And we have our mitral valve right here and our tricuspid valve right here. So what I'm going to do next is I'm going to put color Doppler through the mitral valve. You can see that essentially flow is towards the left ventricle, and there's no regurgitant jet that we can see on color Doppler. Next, we're going to do a fifth chamber view of the heart. And let's see. Almost there.
There.
Yeah.
Perfect.
Okay. So what we're going to do next is we'll actually do a pulse wave Doppler. So I'm going to hit the Doppler button of the fifth chamber of the heart. Remember, the fifth chamber is your actual aortic outflow tract, and this is your aortic valve right here. So I'm going to drop the gates right along the right, just proximal to the aortic valves right here, and then I'm going to hit Doppler. And I'll hit, go to page 2 and I'll hit trace. And based on that, hit trace again. And based on that, we get an estimation of, essentially, we have his heart rate, we have his stroke volume, and we have his left ventricular outflow tract. So therefore, we can get his cardiac output, which is about 3 to 4 liters per minute.